Good afternoon, everyone, and welcome to today's webinar, Equitable Rebuilding from COVID-19, Strengthening Protections for Families, brought to you by the Network for Public Health Law. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them towards the end of today's event. Your moderator for today's webinar is Donna Levin. Donna is the National Director of the Network, where she oversees organizational strategy and operations. Before joining the network, Donna spent 26 years as General Counsel at the Massachusetts Department of Public Health, where she had oversight of Office of General Counsel and led her team in providing guidance on statutory and regulatory authority, the development of major policy initiatives of the department, and legislation affecting public health. Donna will be leading us through the rest of today's webinar. So Donna, over to you.
Great, thanks, Charles. And thanks to our presenters and attendees. In August and again in March, over 50 top national experts offered an assessment of the U.S. policy response to the pandemic. The March volume, called Assessing Legal Responses to COVID-19 Policy Playbook, focused on legal recommendations for a safer, more equitable future. And I'll put this link to these assessments in the chat for you. And today we have 3 of those expert authors with us to focus on some key aspects for equitable rebuilding and strengthening protections for families, as we hopefully see this pandemic recede. And they will talk with us today about the role of SNAP benefits in addressing food insecurity. And then, get my notes, trauma-informed, equity-centered education strategies, and finally, bridging the digital divide. And so now it's my pleasure to introduce our presenters. Matthew Swinburne. JD is Associate Director of the Network's Eastern Region Office. His work currently focuses on issues of food safety and security, injury prevention, chronic disease, environmental health, and cannabis policy. Brook Silverthorne is Assistant Clinical Professor in the Health Law Partnership Legal Services Clinic at Georgia State University College of Law and co-director of the Health Law Partnership, a medical legal partnership with Atlanta Legal Aid Society and Children's Healthcare of Atlanta. And Betsy Lawton is our third speaker. Betsy is a senior staff attorney at the Northern region of the Network for Public Health Law, where she works on a variety of public health law issues, including climate change, mental health, and rural public health. And now over to you, Matt, to start us off.
Good afternoon, folks. I'm going to talk a little bit about the chapter I wrote for the rapid legal assessment. And what I focused on was the use of the SNAP program to respond to the kind of parallel pandemic of food insecurity that was brought about by the harsh economic realities of the pandemic. And what I looked at were key provisions that increased the value of SNAP benefits, as well as made those benefits more broadly available to folks. And I've looked at these things with an eye on, potential benefit after the pandemic, because food insecurity is a public health challenge that existed prior to the pandemic. It was exacerbated by COVID-19, and, this increased food insecurity is going to exist long after the public health emergency declarations are over. So first thing I want to do is I want to look at a baseline of where we were as a country with food insecurity prior to the pandemic, and then look at the magnitude of change, and then we'll focus in on, why SNAP is such an important tool for addressing this, and the ways that program can really be leveraged to help folks out. So this data that I have here is from the USDA's annual food insecurity report. And the most recent data that's out there is the data for 2019, so immediately prior to the pandemic. And at that point, over 35 million Americans were experiencing food insecurity. And this was actually almost a 20 low in terms of food insecurity rates. But food insecurity, like most public health challenges, is a burden that's not borne equitably. And I have some of the data here of the racial distribution of food insecurity in that pre-COVID data. And you can see that people of color are impacted at a much higher rate than their white counterparts. Now, looking at this as a public health challenge, food insecurity increases the risk for a broad spectrum of negative health impacts, ranging from coronary heart disease, certain forms of cancer, obesity, poor mental health. So this really is an important issue to focus in on. Now, what's the magnitude of what happened with COVID-19? Well, food insecurity is driven by poverty, and the economy was, severely impacted by this public health event. And just to give you an idea of the magnitude is, I've seen a report that says an estimated 70 million Americans filed for unemployment as a result of the pandemic in 2020. Now, the official data for food insecurity rates for 2020 hasn't come out yet. That usually comes out September. So this year we should have the USDA's kind of official numbers on that. But estimates have ranged on the high end of 50 million Americans to 45. So you have a huge jump from that 2019 data. Now, early projections for 2021 still has the food insecurity rate, significantly higher, with early estimates of around 42 million Americans experiencing this food insecurity. Now, one of the key things I want to point out, this really ties into that idea of beyond the pandemic, is that the recovery from the COVID-19 economic recession isn't expected until the end of 2023. So if we're looking at states who are beginning to, consider, wrapping up their emergency declarations, I know President Biden has said that he intends to keep the federal public emergency declaration going on through the end of the year. It's likely that the public health response is going to be, kind of officially over before the economy recovers. And this is a key thing to keep in mind. Now, SNAP. Why did I focus on SNAP? Well, SNAP is the largest nutrition program in the country. And I've got participation data from the past couple of years. And you see, before the pandemic, we had a record low in terms of participation because of the strength of the economy at that time. But you can see the jump with the pandemic in the number of Americans who are being forced to turn to SNAP for food security assistance. Now, SNAP is also the largest program in terms of kind of financial impact. And I have some data on the amount of money that's spent on nutrition benefits in the program. And you can see a huge jump in 2020. And this is the result of, number one, more people needing the program, but also some of the changes I'm going to discuss that relate to the value of that benefit. So folks getting more money as part of the SNAP program. And you can 2021 is on pace to kind of exceed 2020 in terms of the amount of SNAP benefits that are needed. Now, in addition to helping feed a large number of Americans, SNAP is important to look at because it provides a strong economic stimulus to the larger economy. And so there's data that shows that during a weak economy, every additional SNAP dollar creates an additional $1.54 in economic activity. It's a job generator. With this additional SNAP spending, it supports thousands of new jobs across kind of a spectrum of sectors: agriculture, transportation, food services, healthcare. So SNAP is important to stimulate the economy, to get it back in a stronger position. So with this program, I mentioned that I looked at government measures that increase the value of the SNAP allotment. And allotment is the term used for the benefit, so the amount of money that a family is given. In addition, I looked at interventions that increase the number of people who would be eligible for this program. Now, there are a lot of things that happen with the program, but I just have time to look at these two kind of major categories and a few examples from each. Now, one of the key things that happened right at the beginning of the pandemic with the Families First Coronavirus Response Act was the creation of the emergency allotments. Now, normally, the amount of money a household gets is based on the income of that household and the number of people in the household. And so the lower the income, the higher the benefit, the larger the household, the larger the benefit. Now, the emergency allotment provision allowed states to increase the amount of money given to SNAP households regardless of their income. And what they could do is they could increase the benefit up to the maximum allotment for that size household. So for example, at the beginning of this process, the maximum allotment, the maximum benefit for a household of 4 was $680 a month. Now, there are a lot of asterisks by that because that amount is going to change as we look at the policies that were put in place. Now, these emergency allotments that states could request, it was initially planned just for the first couple months of the response, but the USDA has been granting 1-month extensions throughout the pandemic, and they plan to continue to do this as long as states qualify. So states, to get the additional funding to provide this emergency allotment, there are a few basic things that need to be in place. The federal emergency declaration has to be in place. The state has to have their own corresponding declaration, and there's some basic data that the state needs to provide. So again, as states are planning to, kind of wrap up their emergency declaration, that impacts the access to this additional help. Now, there were some initial problems with the emergency allotment. The biggest of these is that it ignored households with the lowest incomes. These households were already getting the maximum amount. So the neediest families weren't getting any benefit from the emergency allotment. And it actually accounted for about 40% of SNAP households were already at the maximum allotment. So that's the first problem. But then there's the larger systematic problem with the SNAP program, that under normal conditions, the benefits are inadequate to really provide sufficient and nutritious food. And the Institute of Medicine found that, they were deficient in part because they failed to keep up with inflation. The Food Research Action Center found that kind of the metric or the basis for benefit calculations, which is this thrifty food plan, which is a very frugal budget for providing food for a household, had a lot of issues, so that there were flawed kind of baseline calculations being made. So we have this challenge with the emergency allotment, these two aspects. So, some of the things we were looking at in our recommendation my recommendations, and things that were being considered is, all right, if we have this baseline problem with, the neediest families not getting help through emergency allotments and, kind of that systematic problem of the allotments not being high enough to begin with, is let's increase the value of the allotment. And that will be something that can benefit all households. And so, this is an approach that was used during the Great Recession, 2007 to 2009, where Congress temporarily increased the value of benefits by over 13%. And there was a lot of positive public health outcomes from this. Reduced food insecurity, better health outcomes, decreased healthcare costs, economic growth. So this was something that was being pushed for, but didn't become a reality until the end of 2020 with the Consolidated Appropriations Act. And so starting in January, the benefits for all households were increased by 15%. Now, in the original legislation, these benefits were set to run out. The increased benefit was set to run out in June. Now, you can see what that 15% increase would mean for a family of four. It's over $100 of additional funds per month for food. Now, with the Biden administration, Biden pushed with the American Rescue Plan to extend the sunset date through September of this year. So a couple extra months on this. But the idea is, and we pointed out that the economy, which is driving the need for additional resources for families and food security, isn't expected to be recovered till 2023. So wouldn't it make more sense to target this increase to an economic recovery metric rather than kind of pushing out a few months at a time? So I think that's something that could still be looked at to improve this intervention. Now, the 15% increase wasn't the last thing that Congress did. There's something that's referred to as the enhanced emergency allotment. And this actually grew out of President Trump's executive order back in January, where he directed federal agencies to essentially problem solve better ways to address the economic crisis. Now, in response to this executive order, the USDA released a new policy about emergency allotments in the beginning of April. Now, remember, the families that were struggling the most were already at the maximum allotment. But what this change in policy said was that all households have to get at least a $95 increase in benefits through this program. So families are at the maximum. You can see the progression. Initially, family allotment for family four, 680. 15% increase bumps it up to 782. And then the enhanced emergency allotment takes it up to 879 a month. So we've had this progression of building up the value of the benefit to address the heightened food insecurity. Now, this policy is going to continue the enhanced allotment as long as the National Emergency Declaration is in place. And there are some phase-out provisions for when states start canceling their emergency declarations that allow states to get an additional month as they kind of wind down their declaration. Now, the last thing I'm going to talk about is this increasing eligibility for SNAP. So not just the value, but making sure more people have access to it. And there is a policy that's been in place since the 90s in the SNAP program, and this is the able-bodied adults without dependents classification. And this is for individuals between 18 and 49 who can work and don't have dependents. And the program puts special work requirements on them. And if they don't meet these work requirements, they're limited to 3 months of SNAP benefits over a 3-year period. Well, with the pandemic, there weren't jobs. And so this work requirement was waived through the Family First Coronavirus Response Act back in April of last year. And this waiver is set to expire 1 month after the end of the federal public health emergency declaration. And the economy will still be struggling at this point, meaning it will still be very difficult to get jobs. So it would make more sense to set the expiration for this waiver to an economic recovery metric, so that we know the economy is in a better place to support job opportunities. Now, there's another aspect of this. States have some authority to waive this requirement based on job availability in geographic locations, and they can issue individual exemptions of this work requirement. But there were some problems last year. The USDA issued some very restrictive regulations that would have made it harder for states to issue these exemptions and waivers. And it was expected to kick over 700,000 people out of the SNAP program. Well, cities and states challenged these regulations, and the regulations were actually struck down last October in a federal court case. It was a really scathing opinion that kind of held the agency to task for, number one, passing a restrictive policy during this public health emergency, but for numerous legal deficiencies in the rulemaking process as well as the content of the rules. Now, the Trump administration was going to appeal this, but with the transition to President Biden, that case has been dropped, or the appeal has been dropped. Now, the last thing, something that the network and I've been looking at for a long time is in the SNAP program, there is a lifetime ban for individuals with drug felony convictions. And this came out of the welfare reform of the 90s. And this policy disproportionately impacts communities of color. It undermines the food insecurity of these individuals and their families, and it creates barriers to reintegration. Now, there was no waiver of this policy during the pandemic, but as part of this pre-existing program, states could opt out of this. Now, South Carolina is the only state that has a full ban in place, but there are close to 30 states that have modified bans in place. And you could, individuals will be disqualified after multiple convictions. They may be required to, complete drug testing to get their benefits. And so this is something that, is harmful. And last year, you saw some discussion about removing this ban. And it wasn't out of any of the kind of stimulus bills, but out of a marijuana policy bill looking to legalize marijuana federally. And as part of this bill, they were going to repeal the ban for individuals with cannabis convictions. Now, this bill made it through the House, but died in the Senate. But this idea of repealing the ban at the federal level has been picked up again by President Biden. And it's part of his next round of kind of stimulus plans. With the America Families Plan, it would remove the ban completely. So I think that's important to make this, important food benefit available to people who need it, and to remove kind of the punitive nature of this. That is my last bit of discussion. Thank you for your time. And Charles, you can pass the slides on.
Hello, and let me just advance the slide here. All right, there we go. My name is Brook Silverthorne, and I was also one of the authors in the COVID policy playbook. And me, along with my co-author, Stacy Kirshner, wrote a chapter on meeting the needs of vulnerable and at-risk school-age children, where we talked a lot about the implications of COVID on the education system, which has taken up a lot of media attention as an important issue that children and families across the country are experiencing. So I like to use this framework for discussion of important issues. Basically, it is what it says it is. First, I'll talk about the what. So what happened? What's the issue that we're talking about? Then I will move into more of the substantive discussion of so what? Why does it matter? What are some important things to think about, to reflect on, to ask ourselves as we move forward? And then I will conclude with now what? So what are some lessons learned, some strategies we can actually use, and perhaps build on as we move forward to what we hope will be a better and more equitable education system. So what? We'll start there. Over a year into COVID-19, we all know the what of what happened, right? So in March of 2020, schools across the nation closed to in-person instruction. In fact, by the end of March 2020, all states, DC, the American Samoa, Guam, Puerto Rico, and the US Virgin Islands, as well as the Bureau of Indian Education, either recommended or ordered its school buildings closed. And all but 4 of those eventually did so for the remainder of the 2019-2020 academic year. This affected over 55 million students in 124,000 American public and private schools. At the end of August 2020, the end of the summer, when I think many of us at the beginning hoped, well, surely by fall we'll be back in school. That didn't exactly happen, as you all know. So at the end of the summer, when schools were either starting to go back or about to start the next 2020-2021 academic year, at that time, most states allowed local districts to make decisions about the extent of reopening. And as of last week, 13 states have statewide orders to open schools. And the remaining states either have no specific statewide order, meaning it's then a district level decision, or a partial closure is still in effect. So with the schools closing, online instruction was quickly implemented with no real time for intentional and purposeful planning, which meant that those who had broadband access and broadband accessible devices were able to access school. And those that did not had to wait for their district or their state to assist them, to provide them with access. Teachers were expected on the spot to pivot their lessons to an online format with little or no pre-planning or training. And because education is largely under state and local control, there was no comprehensive plan. The students and families were at the mercy of the forethought of, and the circumstances of their individual districts and their local schools. So most, if not all, school districts were underprepared for a public health emergency such as COVID-19. But this impacted some schools and some students more than others, which we'll talk about more in a little bit. Because of the lack of pre-planning at all levels of the government, from the federal government down to state and local governments, the emergency laws and orders that were immediately implemented were necessary to try to minimize disease spread, but they were not sufficient for other aspects of our lives, including education and well-being. And one last point, one last what point that I'd like to make is that many states and localities early on prioritized opening businesses, including bars and restaurants, over safely opening schools. And there are many reasons for this. One of the primary being the desire to keep the economy going. And that was sort of coupled with the belief that children were less at risk than adults of contracting the disease, and if they did contract it, less at risk of serious complications or death. But that decision hasn't been without consequence, and it may have, just pushed us back slightly when it comes to some of the issues that we see that schools are dealing with now. All right, so that in a nutshell is the what. So what? Why does this matter? Well, like Matthew expressed regarding food insecurity, we see the same pattern in education. We see and we know that inequities existed before. Those inequities were exacerbated by the pandemic. And those inequities and losses will continue long after the pandemic. We're not exactly sure how long after, but we are sure that they will continue after the pandemic. So one of the primary reasons that school disruption caused by COVID-19 has caused and continues to cause such severe consequences is that education is an important social determinant of health, and therefore is linked to long-term health outcomes and risks, similar to the same issues that Matthew talked about related to food insecurity, right? And I'm assuming that most of you on the webinar are familiar with the social determinants of health, but briefly for those of you who may not be familiar, social determinants of health are conditions in a person's environment and community that impact not just health functioning, but other quality of life outcomes as well. So in the short term, access to quality education plays an important role in health and well-being, including nutrition, physical health and activity, as well as mental and intellectual health. But we're also concerned about the impact it will have on students and particular populations of students in the longer term, beyond what they're experiencing right now in the short term. And even though we know that COVID-19 disrupted all students, COVID has exposed and widened the already existing disparities in education and achievement. Betsy will talk about digital access after my presentation, so I won't spend a ton of my time on that particular issue, other than to say that when education is being delivered entirely online, we know that there will be significant gaps among upper and middle class white students and students from lower income families, students of color, students who have disabilities, and other special needs. Access is one issue, but there are other issues as well, and they include the quality of remote instruction, the availability of home support, the home environment, the degree of engagement. So students from low income families are more likely to have a single parent and a parent or parents who are low paid essential workers and were not able to work from home. This posed potential issues with parent support and engagement as it relates to education, but also added stress to those families in particular because of the risk to many essential workers on those front lines of contracting COVID. It also meant that those students received less parental assistance and support during their school day and may have been left alone to contend with online school, or older siblings may have been responsible for their younger siblings. These issues present significant challenges for those students in being able to engage and meaningfully participate in remote education. We see that this bears out in the numbers as well. So for example, in the spring of 2020, it was reported that only 60% of students in low income families and 60 to 70% of students in predominantly Black and Hispanic serving schools were logging in to online instruction regularly. This is compared to 90% of students in high income families. This poor attendance could be due to a number of the factors mentioned, but even more troubling is that poor attendance is also a strong predictor of non-completion of school. National dropout numbers for this school year have yet to be released, but there is anecdotal evidence that suggests that there are steep declines in attendance, a rising number of failing grades, and shrinking enrollment. So by the time we got to the fall 2020, there were some schools that were starting to at least provide some level of in-person instruction. But unfortunately, the schools most likely to remain closed were the schools that were in low-income communities, which were the same communities that were probably most in need of having that in-person instruction. In fact, almost twice as many districts in highly concentrated poverty areas were forced to provide remote-only learning than districts in middle and upper class areas. There were likely many reasons for this: higher rates of community spread in those communities, fewer resources to mitigate the risks, but school building condition and infrastructure certainly also played a role. So more than 40% of school districts in the United States have poorly functioning and outdated ventilation systems in half of the schools in their districts. And because funding for building infrastructure is most often tied to local property taxes, the schools in the low-income communities, as you imagine, are often those most in need of repair. So although we already know that education disruption of COVID-19 has created learning loss and further exacerbated existing disparities, it's likely that we won't know the full extent and the full impact of that for several years. And that's just part of the reason that we can't wait to start implementing protective measures. But before we sort of turn to the now what, I just want to highlight some of the students who are most vulnerable to the inequities and at risk for significant learning loss. Oop, wrong direction, sorry about that. All right, so this slide shows some of the categories of students who may be most vulnerable and most at risk, but it's certainly not exhaustive. We've touched a little bit on students from low-income families and communities, as well as racial minorities. But a couple of others I just want to quickly highlight are students with disabilities or other special education needs, and students for whom English is not their first language. So nationwide, 14% of students receive special education services under the Individuals with Disabilities Education Act, Section 504 of the Rehabilitation Act of 1973, and the Americans with Disabilities Act. Early on, there was a question about how to provide special education services, and after some initial confusion and conflicting messaging from the federal government, the United States Department of Education Office for Civil Rights emphasized through its guidance that compliance with disability laws should not prevent offering distance learning. So by the fall, further guidance was released, basically reiterating that the IDEA provisions were not waived and that students continued to be entitled to a free, appropriate public education, also known as FAPE. And while students were given some flexibility by extending certain deadlines, being allowed to conduct IEP meetings or other special education meetings through remote means, as long as we had parental consent to that, schools remained obligated to provide those special education services. Unfortunately, although those were still required, the practical reality is that many of the special education services that schools provide during non-pandemic times are very hard to meaningfully replicate in a virtual setting. So therefore, the lack of progress and learning loss for students, special education students, students with disabilities or other special learning needs, is a significant concern. And again, there's intersectionality here too. So particularly for students who are in special education, who are in another vulnerable or at-risk group, that those risks and vulnerabilities can be and are compounded. English language learners are another community that has been one of the most vulnerable to the inequities and at risk of learning loss. So English language learners make up roughly 10% of students in the United States. these students are more likely to live in low-income communities, to have parents who are low-paid essential workers, to have disproportionately less access to broadband and broadband devices, live in multi-person or multi-family households, and not have the parental support needed for many reasons, not the least of which is that their parents may not speak English to be able to help them succeed in an online only education environment. So these are all additional factors that contribute to the widening achievement gap between English language learners and English speaking students. All right, so let's get into the now what. What do we do about this? As you can see, I attempted to illustrate on the slide here that part of it is, looking forward. It's a little blurry view of exactly what is going to happen moving forward. But we do have that sort of clear view of the rear, right? What just happened. And we need both, right? We need to be looking at the past and learning from the past as we're sort of navigating this new sort of fuzzy reality that we're entering. And so, one of the important questions to ask is, what have we learned? And what do we need to continue to learn more about in order to both address what has already happened with educational inequities and the resultant learning loss and the widening achievement gap, and create equitable schools moving forward? So it's going to have to be a multi-tiered, comprehensive, intentional approach. I've put together some of the components that I think are most necessary and some of the questions that I think need to be considered. So again, this list is certainly not exhaustive. It's going to be an iterative process. There are things that we don't know yet, but that we'll learn as we continue to commit ourselves to the process of moving forward and building. So it's not an accident that the first item on the list is funding, and I hate that it is, but we live in a society that funds the things it values. You could probably guess by my tone that I think we need to value education more than we do. Many of the other items on this list will require funding to get done, but first we need to decide that it's worth it to us, that we value it. I was on a webinar last week, and as part of the panel, there were 3 students who talked about their experience during COVID. And it was a great panel. I think we all have a lot to learn from students themselves. But one of the students said something that really resonated with me. So she said, adults always want to say things like, children are our future. And maybe that's true, but we are also here right now. And I thought, wow. We say that a lot. Adults say that a lot. Oh, children are our future, therefore we need to do X, Y, or Z. Or children are our future, therefore we need to do, X, Y, Z. And sometimes we forget that they're standing before us right now. And, we need to do this because right now matters, and they matter, as opposed to thinking about it as some, thing in the future that maybe there's some time. And so it created some urgency for me, right? And I think as adults, sometimes that gets lost on us. So in speaking about funding, historically, and as it stands today, the federal government's role in education is basically as a limited funder. In non-COVID times, the federal government chips in roughly about 8% of education funding, with state and local government splitting the remaining 92% of funding, and also the larger role in the governance of education. So one of the consequences of that is that there is a vast number of different governance models, which is significant to this discussion because many of the actions that will be necessary will either be state or local actions down to the districts themselves. And also, we're going to need both short-term and longer-term strategies. I'm a big proponent of concurrent planning. We had some recommendations from the chapter related to funding at the federal government. We want the federal government to just continue the flexible funding designed for education sector response to COVID to reduce disease spread, prevent learning loss, and close the achievement gap. And we'll talk a little bit more in a minute about how Congress has done that so far. On the state and local government level, we want to see revamping of school funding formulas to reduce that proportion of local funds because they're tied often to local property taxes, which sort of bakes in inequity into the funding scheme. We want to also create funding and as well as practices and procedures for contingency plans, coordination plans in the event of another public health emergency so that we don't continue to be underprepared. We want to ensure that there's some flexible reallocation of already existing resources should the need arise. And we want to ensure that we have a bank of funding for school nurses, for social workers, for those support staff. But beyond that, I want to talk, and I will come back to funding at the end, but I do want to talk quickly about some other strategies. So some short-term strategies must include teacher training and professional development related to providing equitable instruction, evidence-based strategies for learning loss, professional development on trauma-responsive teaching, and social emotional learning, just to name a few. So my dad was a middle school teacher. I'm also married to a K-12 teacher, so I get to hear their perspectives a lot. And we have some amazing teachers out there, but we need to invest in the profession as a whole. And I think that starts early by developing pipeline programs to attract educators from low income and minority communities. We need to, think about paying teachers a wage that's commensurate with the value that they truly provide in our society, which again comes back to funding. Another short-term strategy is providing on-site vaccinations to students and their family members, as well as rapid testing. We have the ability, I think, finally to do some of that. And so that's something we should absolutely do. As this school year, I think many schools are, either already out. Those in the South, where I am from, are, winding down school. Those in the North are probably right around the corner of ending. So we have the whole summer to sort of plan how this will work for the fall. Districts and schools can also use some of the federal relief package funding to hire additional teachers and support for remediation, including intensive support, increased learning activities, curricular resources. The National Center for Learning Disabilities recently released a report on promising approaches to accelerating learning. It includes streamlining curriculum, building in extra time to teach prerequisite skills, and tailoring instruction based on students' strengths, needs, and interests. So these are strategies that can be utilized not just for students with specific learning disabilities, but also for students who have had more significant learning loss for some of the other reasons that we discussed as well. Schools should consider implementing a structure to support both academic learning loss and the social, emotional, and mental health needs of their students. We know that health isn't just impacted by education, but it also impacts education. And this year has been a really good lesson about the impact of our social emotional health on our ability to attend to what we need to do. This isn't true just for students, it's true for those of us who are in the workforce as well. These strategies can be done using COVID relief and other funding, such as Project Aware grants for school-based mental health centers, just as an example. So some strategies that can be started in the short term, but will likely require longer term strategies include implementing equitable policies and practices. And what I mean by this is really the school board at the district level or the administration at the school level taking a look at those policies, practices, and procedures and asking themselves whether they really address equity. And if not, being very intentional and inclusive about drafting, passing, and implementing equitable policies, practices, and procedures. Taking what they've learned over the past year and really taking another look at those and seeing what needs to be amended, what needs to be added, what needs to be changed. And this means involving students and families in the discussion and the drafting of the policies. It means really engaging all families in the process and in the implementation and vision for the school. And I think this will naturally lead to some more long-term strategic planning for schools, which is centered on equity. And for that process, I would really encourage school communities to consider a human-centered design process that really incorporates the families and the students as decision makers and designers in the process. And this may sound like a radical idea, and in some ways, it may be, but there is some traction to using this model and this method in education policy, which leads me to my next question, which is focusing on the school itself really enough? And from a public health perspective, I would say no. If we're really serious about creating equitable schools, then we also have to address the issues that students bring to school with them and the impact, those that impact their learning and their school achievement. Schools don't exist in isolation, right? So that's what I mean when I say multi-tiered strategies. We also need to invest in the community, develop partnerships between the communities and the schools, invest in better broadband, not just for the school, but for the whole community. Invest in the healthcare system and the mental health care system. Invest in jobs and housing and pathways to those for the communities that haven't had those pathways or whose pathways have been blocked. So that's sort of my long-term 30,000 foot look at strategy. So in the last couple of minutes, I just want to talk a little bit more about funding, because at the end of the day, most of the things I just mentioned are going to require money in varying degrees. All right, so as I mentioned, pre-COVID, federal funding comprised about 8% of total education spending, and that's had to increase this year. This past year due to the pandemic. So in the span of about a year, from March 2020 to March 2021, Congress passed and two different presidents signed 3 COVID relief packages. The CARES Act in March 2020, the Coronavirus Response and Relief Supplemental Appropriations Act of 2021 in December 2020, both signed by President Trump, and the American Rescue Plan in March 2021, signed by President Biden. And as you can see, with each successive plan, more money was provided specifically to education. You can see in the second chart that between the relief funding packages, the funding per student is significantly higher than typical spending structures under Title I and IDEA. So the first 2 packages were a little less directive about spending, allowing a broad range of spending that permitted districts to use the funding essentially for any activity allowed under federal education laws. And the distribution among school districts was also in line with the proportion that they received through the Title I Every Student Succeeds Act. The most recent American Rescue Plan is more focused on helping schools to safely reopen and on addressing learning loss. So in fact, school districts must spend at least 20% on addressing learning loss and addressing safely reopening schools. $3 billion is dedicated specifically to supporting students with disabilities. Health-related expenditures are allowed, as is school construction and repair. And as to safely reopening, it requires states to submit plans for the safe return to in-person instruction and continuity of services. So the interim rule right now requires that in developing their plans, states must consult with a wide range of stakeholders, including students and families, but also school staff, community groups, specific populations of students in foster care, education, English language learners, children who are experiencing homelessness, children with disabilities, just to name a few. So I think the new sort of federal Build Back Better sort of mantra, you know, to the extent that they are recognizing that in order to build back better, we need to include everybody at the table. We need to include the folks, the students, the community, the families that are most affected and impacted by the changes we make. They're really creating sort of a structure to allow that to happen. So I think it's a good start to opening up the dialogue, to providing a voice at the table, particularly for students and families who've been traditionally and historically left out of that planning. My hope is that we really can engage those specific populations, and that we don't just continue to listen to those that have always had a voice, or those who have always sort of had a place at the decision-making table. So again, multi-tiered process. It's going to require hard work, bravery, courage, and a lot of intentionality. So we have our work cut out for us, but I'm optimistic that we can get it done. So with that, I will turn it over to Betsy.
Thanks, Brooke. Hello, everyone. It's great to have you with us today. I'm going to switch gears to discuss broadband access. So broadband access and its impact on public health, what disparities in access mean during the COVID pandemic, and opportunities to reduce the digital divide. So first, I just want to take a minute to capture the relationship between broadband access and public health. Broadband access significantly impacts all of the social determinants of health. So without broadband access, educational opportunities are diminished. And during the pandemic, kids are unable to even reach their classrooms at times. A lack of broadband also can affect economic stability, limiting job seekers' ability to find and apply for jobs. And without broadband service, households may lack sufficient access to healthcare and mental health and addiction services that are increasingly provided in a telehealth setting. And then a lack of broadband also limits access to many of our social supports and opportunities for civic participation that have moved online. So unlike other essential infrastructure, though, broadband service is largely provided by private companies without significant federal oversight over prices or infrastructure development. And there's very limited competition in many areas of the country where there's only one or two providers, and in some places there's no providers at all. So there are two main reasons that households may lack broadband services. The first is access, meaning the technology and the infrastructure is simply not available in certain areas. This predominantly occurs in rural areas, but there are digital deserts in urban areas where broadband service providers don't see an economic benefit. The other major barrier to broadband adoption is affordability. At an average cost of about $60 a month, broadband subscriptions are increasingly out of reach for lower income households. I just want to go through some quick statistics on the size and impact of the digital divide. So by some estimates, upwards of 40 million individuals cannot access home broadband service. FCC estimates much lower. According to FCC, 14.5 million individuals do not have access, but the FCC does admit that this is an undercount of the digital divide due to the way it collects its data. But still, the FCC data can show us some pretty important things. One thing to consider is that while over 25% of individuals living in urban areas do not have home internet, despite the fact that they have available service in nearly all urban areas, according to FCC's data. And while 17% of individuals living in rural areas lack access to fixed broadband infrastructure, 35% don't subscribe to home broadband service. And more than 50% of residents of tribal lands do not have home broadband. So what this tells us is there's a limit in infrastructure, but one of the larger problems that's keeping households disconnected is affordability or inability to connect at their house due to those expensive prices. There are significant disparities in adoption rates in Black, Latinx, and Native American communities. Black neighborhoods have much lower home broadband adoption rates than white neighborhoods, and tribal communities fall far behind in accessibility. For 32% of residents on tribal lands, there is no broadband service provider, and another 36% of residents have access to only one broadband provider. So these disparities can contribute to large disparities in educational access as well. Some data from the fall of 2020 shows that 27% of Black households and 29% of Hispanic households with K through 12 students lacked consistent access to broadband services needed to support online learning. And at the same time, only 20% of white households lacked consistent access. So limiting the digital divide is particularly important to prevent a stark expansion of educational disparities for those kids that can't access their classrooms due to the lack of a home broadband connection. And the COVID pandemic has heightened the need for internet connectedness. Employment and educational opportunities have moved online. Individuals increasingly rely on telehealth services. But at the same time, opportunities to use public Wi-Fi have diminished. So you can't go to your school and your library anymore and as readily access broadband through that source. And the economic fallout of the pandemic has made broadband service unaffordable for many, many households. And the federal government response to addressing the digital divide during the pandemic largely relied on funding for schools, securing voluntary commitments from broadband service providers to waive late fees, not terminate service, and open Wi-Fi hotspots, and encouraging broadband service providers to provide service and hotspots to students that were disconnected. FCC has also made some short-term revisions to its Universal Service Fund programs. These programs are their long-standing affordability programs, and they're meant to ensure that all households in the United States have access to and can afford both telephone and broadband services. And two programs that are particularly relevant to addressing the digital affordability divide is the Lifeline program. And this program provides a small monthly discount of $9.25 on broadband service for low-income subscribers. To increase access to this program during the pandemic, the FCC waived several program rules to make it easier for newly eligible participants to apply. And FCC also barred de-enrollment for current Lifeline subscribers. However, FCC did not increase the benefit amount, and the discount isn't enough to make internet affordable for many households. The second Universal Service Program that's essential to affordability is the E-rate program. And this program provides discounts for broadband connectivity at schools and libraries. So to help with remote learning, FCC waived program rules that had prevented recipients of E-rate funding from accepting free connections or equipment to support remote learning. So this waiver temporarily allows broadband providers to provide free mobile hotspots and broadband-enabled devices to schools and libraries. These devices and hotspots then can be distributed to students that lack home broadband. However, FCC did not, despite having several petitions asking it to do so, authorize schools to use their E-rate funding to provide home broadband service directly to students that lacked home broadband. And this left many disconnected students with few options to connect to online classrooms. This left states and school districts to pick up where the federal government efforts fell short. And among other things, communities dealing with school closures and remote learning have connected students by paying for broadband service to homes and outfitting school buses with Wi-Fi hotspots. And they used federal funding, some of that CARES funding that we discussed earlier, to make this a viable option for their students. But was it enough? The government response did help a bit, but there's some more recent statistics that tell us that more is needed. So the number of Lifeline subscribers receiving that $9.25 monthly benefit increased by about 2 million households between June 2020 and April 2021. However, over 40% of the applicants were still denied access to the program due to application errors. And only 27% of eligible households actually subscribed to the service. And then school district efforts created a temporary support system. However, it's still estimated that in the fall of 2020, 12 million students remain underconnected. The FCC's response largely sought voluntary efforts by broadband service providers, but it didn't expand its affordability programs to make home broadband service accessible. And the FCC chairman called on Congress to take action to ensure that households could access the much needed broadband service. And Congress did step in December 2020 as part of the Consolidated Appropriations Act of 2021. They developed several short-term funded programs to bridge the digital divide. First was the emergency broadband benefit, which is used to offset broadband service costs for low-income households. And it provides a benefit of up to $50 per month, which is significantly more than that initial Lifeline benefit, which was more like $9 per month. And that broadband, emergency broadband benefit has made broadband affordable for many households. And the program enrolled 1 million households in its first week. And that, I think, alone is evidence that it was a success and a much needed sort of intervention to get broadband into homes. The Consolidated Appropriations Act also included the Connecting Minority Communities pilot to support broadband services at tribal colleges and universities and historically Black colleges and universities, and provided $1 billion in grants to tribal governments under the Tribal Broadband Connectivity Program to support broadband infrastructure and affordability programs. And there was a bit of funding in the Consolidated Appropriations Act, about $300 million to support rural broadband infrastructure in the act. At the same time, FCC in late December, or November, December, had allocated nearly $10 billion for rural infrastructure development as part of its Rural Digital Opportunity Fund program. That's a program that existed before the pandemic, but it is also increasing access to infrastructure in rural areas. And then there have been continued efforts to provide home broadband to disconnected households. And those include the American Rescue Plan Act, which provided $7 billion to support remote learning. And this funding can be used to provide home broadband service directly to students who are trying to access their classrooms from home, but don't have home broadband service. FCC is also considering public comments on several petitions that ask the Commission to allow those E-rate funds for schools to be used to pay directly for home broadband service during the pandemic. And the Biden and Harris administration has proposed a sweeping commitment to connect all individuals in the US as part of the American Jobs Plan proposal. So the goal of the proposal is 100% coverage of broadband service, and it would prioritize government, nonprofit, and cooperative networks. And instead of providing sort of longer term subsidies to lower income households, the aim of the plan is to make broadband service more affordable for everyone by increasing competition and reducing barriers for local municipal owned networks. So while all the pandemic related digital inclusion efforts and affordability programs are key stepping stones to bridging the digital divide, most of these programs are temporary or will expire in 2 or 3 years. So permanent action to promote equal access to broadband is needed. And there's 3 recommendations here listed on this slide. The first is leveraging the FCC's affordability programs. And that would be allowing that E-rate funds to be used for home broadband service, and increasing the Lifeline discount to $50. And that would make broadband affordable to many more households for the long term. Increasing FCC oversight could also help address the digital divide. So FCC's lack of regulatory opportunities during the pandemic to address the digital divide stemmed from a 2017 decision to release broadband providers from common carrier regulations found in Title II of the Communications Act. Reinstating common carrier status for broadband providers could provide increased regulatory oversight for FCC, expand coverage to more areas of the country and to more individuals, prevent unjust or unreasonable discrimination in charging, practices, facilities, and services. And it would also provide an avenue for individuals to file complaints with FCC alleging discrimination in service. And it could increase the number and type of providers that can offer that Lifeline broadband benefit, which would hopefully increase the number of eligible subscribers. And then the last recommendation has to do with municipal broadband. Removing the barriers to municipal broadband service could also increase competition, lower prices, and make broadband service available in more communities. By providing broadband service owned and operated by municipalities, tribes, or rural electric and telephone cooperatives or public-private partnerships. This would increase competition in the market and allow local communities to provide service directly to underserved areas. There are over 300 municipal broadband networks in the US currently, but about 20 states have enacted laws banning or placing serious restrictions on municipal broadband networks. However, some states and localities are working to support the community broadband networks. Even this year, for example, Arizona passed a law that authorizes rural electric cooperatives to provide broadband service, which will hopefully expand broadband networks into more rural areas. And Denver residents passed a referendum that would allow municipal broadband in their community. The state of Colorado requires cities and municipalities to have such an approval before they can move forward with creating their own municipal broadband networks. Congress could speed this process along, certainly, and pass legislation that would bar states from preempting or restricting local public broadband services that are created to fill these gaps in access. And there have been several bills in Congress over the years to specifically bar states from restricting public and municipal broadband. But to date, none of these proposed bills have become law. And now might be an opportune time to increase access to broadband through municipal network services. And those are the three recommendations that have come out of sort of this shifting scenario of how broadband access has been supported during the pandemic. But the bottom line is that the COVID pandemic illuminated many of the inequities facing households without broadband, and it highlighted the need to prepare for the future by ensuring home broadband is available to all individuals, so everyone can participate in education, healthcare, the job market, and society. So with that, I'm going to turn it back over to Donna and Charles for a question and answer session.
Great. Charles, did you want to talk about Q&A first? You want me to jump into questions?
I think we're good to jump right in.
Okay, great. Well, keep questions coming if you have any. I want to thank all of our speakers. We went a little long, but I think you'd all agree they shared a great deal of really important information. So we do have some questions for you speakers in the time remaining. So I'm going to start with Matt. You mentioned that many of the changes to the SNAP program should be linked to the economic recovery of the country rather than the end of the federal public health emergency declaration. What economic metrics are being discussed as appropriate alternatives?
Well, this is an interesting question. I am not an economist, but I have been looking at kind of the discussions around this in the food security space. Now, for example, the 15% increase to the SNAP allotment, is a temporary increase. I from a policy perspective, I think because of the underlying problems with the benefit calculation, there should be a permanent increase to that, but that may be politically difficult. So when looking at the temporary increase, the economic metric that I've seen discussed is tied to unemployment rate. So that, for example, the economy is within 1.5% of the pre-COVID unemployment rate for 3 consecutive months is a metric I've seen used. So, the pre-COVID, I'm going to just use rough numbers. The pre-COVID unemployment rate was close to 3.5%. So the nation would have to experience a 5% unemployment rate for 3 consecutive months before, the temporary increase in the allotment is repealed or the waiver of the ABOD requirement is repealed. So rather than kind of this, I think, political bargaining to keep pushing it a few months at a time out, actually have a calculation that looks at more of when the need for the expansion is no longer present. But as I said at the beginning of this, I think some of these changes, should be made permanent because of the good they could do.
Thanks, Matt. So a question for Brooke. What do we know, if anything, about the magnitude of learning loss due to COVID and its impact long term? Have there been any studies, et cetera?
Yeah, so that's a great question. It's a question that a lot of I think researchers and education organizations are really looking at. There is a recent McKinsey study that says that basically the students are an average of about 6.8 months behind right now. And so, I think that there's been a lot of attempt to sort of extrapolate what we know about temporary school closures in other contexts to the COVID-19 experience as well. One of the things, that I think will be interesting is to see if you really can extrapolate, among different reasons for temporary school closures. There have been some teacher surveys and some other surveys that have gone out, which nearly all of the educators that have been surveyed reported seeing some learning loss in their students over the past year when compared with children in previous years. And a majority of those teachers who were surveyed, so 57% of teachers surveyed, estimated that their students were behind by more than 3 months in their social emotional progress as well. So, I think another of the interesting questions will be how long will the learning loss continue, right? So if we look at right now, students, if we just take the 6.8 months behind number, say, okay, right now, students are an average of 6.8 months behind. What is that going to look like in the longer term? What is that going to look like in a year? Because there's a recent article out by the International Journal of Educational Development, which talks about, a 3-month school closure could reduce long-term learning by a full year's worth of learning. So it'll be interesting to see when we sort of get to a point where we can look back and do some more robust sort of empirical studies about what this has meant for learning and what it will mean going forward for those particular students as they move into the workforce and their earning capacity and the country's economic stability and all sorts of other collateral issues that are impacted by learning loss.
Great, thanks, Brooke. All right, I see a question for Betsy here. What do you see as public health's role in working on the digital divide?
Thanks. Public health can play a lot of roles in addressing the digital divide. You know, I spoke a lot about federal laws and the structure of broadband reimbursement and laws in the country, but certainly public health can help provide data on what the public health impacts are of not having broadband. It's certainly an issue that can be raised via the public health avenue, and can also support the use of these smaller community networks and identify neighborhoods that are in need. So certainly, you know, in Denver, there was a referendum passed in November that will allow the city to move forward with a municipal broadband network if they so choose. It's just one step in the process. But certainly participating or, you know, putting out information about the public health benefits of having affordable broadband is useful during those discussions. And it can also lead to, you know, triggering those discussions where they aren't happening.
All right, I'm going to return to Matt with another question here. Are there any other changes to the SNAP program that have been helpful during the pandemic that have potential to impact food security beyond the end of the pandemic?
Well, one of the things that I was, you know, interested in as a change to the SNAP program is really the online SNAP program. So back in 2014, legislation was passed ordering the USDA to have a pilot program that would enable folks to use their SNAP benefits online. And prior to the pandemic, the idea was that this would make food accessible to folks who have, you know, mobility issues and getting to the store is difficult, or they live in a community that doesn't have food resources where they can get nutritious food. And there was a slow implementation to this, so that in 2019, New York State was the first state to be brought on board to this. And, you know, it was a program with limited retailers. And with the pandemic, this was seen as an important tool for social distancing, so that, you know, you have less folks going to the grocery store, less chances of exposure. And the federal government really fast-tracked this to try to get states on board so that they had, you know, a functioning online SNAP program in their jurisdiction. And now there are 47 states and DC that have a functioning online SNAP program in their state. And, you know, this was driven out of, you know, the need for social distancing, but, you know, the initial benefits that the federal government was looking at in terms of improving access to folks who live in communities that are in, you know, the term that folks are familiar with, food deserts, and, you know, increasing access to food resources for folks with mobility issues. That is really up and running now because of the pandemic and the need for social distancing. So I think that has, you know, a real potential for, you know, doing some good. I think there's still some challenges with that, but I don't want to talk too much. I could talk for another like 30 minutes, so I'll cut myself there.
Okay, thanks. Good answer. And Brooke, can the president or Congress force all schools to open?
So the federal government cannot likely force the schools to reopen, but what they can potentially do under their spending powers, right, is that Congress could actually tie future COVID relief funding to school reopening. And so it's sort of, can the president or can Congress, unilaterally say to the schools, you must reopen? No, but can they say, okay, states, if you want to, have this funding available to you, you need to be open. And so it's kind of a backdoor way of doing that. So, I think the answer is directly no, indirectly potentially yes.
Right. Okay, let's see, Betsy, last question for you, and then we're going to hand it back to Charles for the last 2 minutes. Are states and localities doing anything to help expand access to broadband? What barriers might states and localities face as they try to expand broadband?
Yeah, so I live in Minneapolis, and I know that Minneapolis had opened all of their Wi-Fi hotspots throughout the city to try to connect many students who weren't able to access. So cities can take those types of actions that they may have control over certain Wi-Fi hotspots. But I think the longer term solution is development of those municipal broadband networks or broadband networks run by electric cooperatives or rural electricity cooperatives. As I mentioned, there are quite a few barriers in almost half the states in the nation that really limit the ability for cities and localities to create their own broadband networks. A lot of that has to do with opponents of those systems think that it should be, there would be an added benefit for communities that the private sector wouldn't have if municipalities were allowed to jump into the game. But we've seen that there is a need in a lot of areas for more competition to drive down prices and even just create more access. So I think addressing those state laws that preempt localities from developing their own networks, and then on the larger federal level, Congress could take that action too and just preempt states from preempting municipalities. Double preemption.
Great, thank you. Thank you, all speakers. I'm very appreciative of all the work you did for the chapters and for writing the chapters in the 2 volumes and for speaking with us today. Over to you, Charles.
Thanks, Donna. And thank you again to our speakers for your great insights. Just a few quick final notes. All attendees will be receiving an email from the network with the slides, video playback of this webinar, and our brief webinar survey. It takes just a minute to fill out and provides us with some really great insights. Also join us for the next webinar in this series on June 22nd, which will be on equitable rebuilding from COVID-19 and strengthening protections for communities. You can learn more and register for that webinar on the network's website. And finally, join us for the 2021 Public Health Law Conference this September in Baltimore. We hope to host the conference in person, but we will be providing updates to our registrants with developments as time goes on. So that concludes today's webinar. Thank you all for attending. Have a great rest of your day.